COVID-19 may seem like a distant nuisance, but it really is a nightmare for millions of Americans and continues to be so. The CDC actually estimates that 17 million U.S. adults suffer from more than 200 symptoms linked to what's known as long COVID or long-haul COVID. Today's guest explains that the culprit is really the virus's notorious spike, a very unusual spike protein which impacts over 300 biological pathways in the body and the mind, and it opens the door to chronic disease and even accelerating aging. I'm really excited to introduce my colleague and friend, Dr. Robin Rose. Thanks for coming on Healthy Longevity, Robin.
Thanks, Florence. It's my pleasure, and I'm honored, and I'm so happy to be here with you.
I'm delighted, and I see we both got the dress codes.
I know, we are twinning today. I love it.
Which is fun for me because I grew
up.
We
had no idea. We walked in, I was like, twins. So cute.
All right. Well, let me tell our listeners a bit about you, Robin. Dr. Rose is a board-certified specialist in two areas of internal medicine and then deeper into gastroenterology, or GI disease. That's gut health, and long COVID is the specialty areas that she focuses on within those specialties, but she knows a lot about a lot of things. She's the author of the 28-Day Gut Fix, and she's founder and CEO of Terrain Health, where she practices next-generation precision healthcare, integrating systems biology with an innovative approach that really requires a very deep understanding of each person's biochemical, genetic, and lifestyle factors. And in fact, she went on to get a degree at the Institute of Functional Medicine, so she really got the whole program of what we do with the systems approach in a human body, because each of us is unique and very complicated. Her comprehensive approach prioritizes patient-centric care to create healthcare interventions that are precise, personal, predictive, participatory, and preventative. Her philosophy is deeply rooted in healing her patients from the inside out so they will age less. Dr. Robin received her medical degree from the New York College of Osteopathic Medicine and graduated with honors. She did her postgraduate training in internal medicine, followed by a fellowship in gastroenterology and hepatology, which is GI, or the gut and liver, at Beth Israel Medical Center in New York City. I'm so glad to see you again, Robin. We finally made it work out, and we have so much to talk about regarding the gut-brain axis, balancing hormones, and of course, long COVID. Join us on a two-part case study talking about various women and their issues with hormones. So let's turn our attention to your interest in long COVID and how you came to focus your research on it, because I have to say that I was shocked by the extent of disease that persists after COVID.
I got into long COVID just because, being a functional integrative doctor, I think we do a much deeper dive into obviously looking at how a patient detoxifies, handles stress, inflammation, and we really look at quite an extensive amount of biomarkers, like compared to like other, like typical
doctors.
Primary care doctor, right? You're probably getting like your average 42 analytes, whatever. We're doing like quadruple or more of that when we look.
Yeah.
And so I started seeing but even in the basic blood work, I started seeing particular abnormalities that didn't seem right to me. So, for example, I started seeing white blood cells were really low, like 2.2, 3.2, 3.5.
And then the average is usually somewhere between 3.5, which is low,
or 380,
to
3.8 to 4.
10.
Yeah.
And even though within that, individuals
that's even
can
low,
vary dramatically. So
right.
you were seeing consistent low levels.
Very,
of white blood
very
cells.
low.
Did you do lymphocyte subsets as well, looking at
So
killer cells?
So I did not at first, but not at first. I did eventually, but right in the beginning, at the end of the beginning of 2021, when I really started noticing difference in the patterns, and then I saw that for some reason, and just so you know, as a conventional gastroenterologist, and this was really the year I left. I left my conventional practice in 2020 during COVID. So I did blood work on thousands and thousands of people every year, right? And I always did CBCs. I did iron studies because that's what GIs look at, for bleeding and things like that. So I'm used to always seeing a typical iron deficiency anemia, low ferritin, low iron, right? And maybe I can count on one hand a year the amount of people I'd see with leukopenia or a low white count, right? Maybe on one, not even all fill up the one hand. And now I was seeing dozens and almost every patient walking through my door with this pattern. And then I would see The other
How were they presenting as your typical patient? Like,
Yeah,
why were they
coming-
coming to
they
see
were
a
coming
GI
in-
doctor?
No, they were coming in for functional medicine.
To be
Some were having
studied.
GI symptoms. Some were having autoimmune disease, whatever it is. Some wanted health optimization, right? So
Okay.
it was in my initial intake because after I see them for the first time, then I would do the slew of blood work that most of us get to really take that deep dive.
What were the common symptoms that crossed the path that made you look at this more deeply?
It wasn't even, okay. Well, the findings in the blood work, right. Like, so whatever. And I was seeing, that's what I'm going to tell you. I was seeing very peculiar, like I'd see normal or high irons with low ferritins. And I figured that out. We had someone help me figure that out after the fact, why that was happening too. And then the other thing I just wanted to add was I did next generation sequencing of the gut microbiome on pretty much all of my patients. And I saw patterns in the species and phylum that the patient lacked occurring as well in almost all the patients.
So let's take a step back so we can explain to the listeners what is next step sequencing, right?
Next generation. So basically you're
next-gen
mapping out
sequencing.
the microbiome, like the gut
Exactly.
microbiome, like we have trillions of bacteria that live in the gut.
Not just bacteria, there are other
Trillions
kinds
of
bugs.
organisms, fungi, parasites, bacteria, viruses, everything lives there,
Yeah.
but mostly it's bacteria. And so when we're doing the mapping, we're looking at these different sort of like, if you think about it, like how do I explain it? In the animal kingdom, right, you have like different classes of like, you have mammals, reptiles, amphibians, right? And I say the same thing in the bacterial kingdom. You have different sort of phylum or classes of bacteria. And under each one of those classes houses different like genuses, families, species of organisms.
Kind of goes back to basic biology that we
Yes.
learned in medical school, where we used to look under a microscope to look for gram-negative rods or gram-positive cocci.
Yeah.
And those will represent different types of bacteria, whether it's in urine where it shouldn't be or in the gut.
Correct. And you want these bacteria should be really living in your gut, but they should be in balance. So you have good players and bad players, or the good bacteria, the unfriendly bacteria, the friendly bacteria, and they should be in balance.
And the reason you want them in balance is because they're actually responsible for engaging with nutrients and metabolizing it, passing it into the body, and being able to contribute to your overall optimizing health.
You said that beautifully, 100%. And when it's not in balance, you might have heard the word, it's called dysbiosis. You have this imbalance where you have like a lot more of the unfriendly or like pathogenic bacteria over the friendly. And then that disrupts everything that you're talking about, like all of these, what we call postbiotics or metabolites, from being produced the right way. And then as a result of that, and not having the right metabolites, not having the right bacteria taking up real estate in your gut, then you get what's called leaky gut. Everyone has heard of that phenomenon where the gut is actually, it should be the whole mucosa, the intestinal mucosal lining should be very tightly sealed together. But what happens is you start getting these separations,
At
okay?
the junctions, and almost like holes, which is why it's called leaky. So it's almost like the hole allows for permeation. It's very classic in a lot of disorders, but particularly celiac
Autoimmune.
and
Most
autoimmune diseases and
yeah.
all inflammatory bowel
Correct.
diseases.
So you have this basically, what's happening is you have this constant stimulation to the immune system because you have things leaking out that should be contained, right? Because what is the job of the gut? The job of the gut is to assimilate and eliminate, right? To absorb all those beautiful, amazing nutrients and things that we're bringing into our body, and then to poop out all the bad stuff. But now what's happening is those bad things, or the things that are foreign to our body, start leaking in to our bloodstream, and it's poking our immune system over and over again. So you have sort of this low-grade chronic inflammation that's just occurring all the time. And that's why, like I always say, it's like the bucket theory. It's likely coming from the gut, like an autoimmune disease that you get, or even maybe cardiovascular, diabetes, a neurodegenerative disease. It's this constant poking, and like, when did that last drop fill up your bucket, right? And you spill over because it's just happening over and
Kind
over
of like
again.
the last straw. You've been
Yeah.
leaking, you've been
Yeah.
getting interruptions to your immune system, and at some point your immune system is like, enough. And that's
And
it.
then
And something happens in
and
your
then whatever
body.
maybe you are likely genetically predisposed for,
Exactly.
then that manifests. That's, again, going into epigenetics,
Beautifully
right?
said. Yes, exactly.
Getting into epigenetics. Like, your genetics is only like 10 to 15% of what happens to you, and the other 85% is how you interact and adapt to the world around you, right? And why did that bucket fill up quicker in a 10-year-old than somebody that's maybe 40 years old, right? Like that's how
Depends on your
Right.
makeup, and largely
Yes.
that's driven by genetics,
Yes.
but it plays a big role in terms of how you engage with life
the world
and illness in the world.
Yeah. And so, all right, as we digress, but the point is that these bacteria, these phylum or classes of bacteria were basically gone. The one phylum, which is called your actinobacteria phylum, sorry, say that 5 times really fast, I'm just kidding. And that houses your bifidobacteria species. Now, bifidobacteria species, most people have heard of because it's in a lot of our yogurts and probiotics that we take and things like that. But why the bifidobacteria is so important, and the fact that it was gone and absent in the vast majority of people post-COVID or post-vaccine, was really quite perplexing and alarming to me. And you need your bifidobacteria for so many different reasons, but especially for your innate immune response, right? That's your initial, like how your immune system responds to an infection when you're initially
So missing
exposed
that
to it.
bacteria changes the way your immune system can fight an infection.
Correct.
So it's internal. Our immune system both needs to recover while we sleep, but if it's been damaged nonstop and it doesn't have these bacterial forces, it doesn't behave in the right way. And so you're vulnerable.
Right. So not only are we destroying the gut microbiome, dysbiosis, leaky gut, not having all the right metabolites or the postbiotics there, now we have this other issue of just lost species, right, that are going to contribute and make this whole vicious cycle even worse.
Now, how does that relate to the spike protein? Is there a relationship there? Did the spike protein damage and live in cells and destroy this intact
Yes.
mucosa of the
Yes.
GI tract?
So it's an awesome question. Sabine Hazen is somebody that I work with as well, and she does a lot of my sequencing now for me. It's called the progenobiome test. She basically was one of the first people to publish that the spike protein from the vaccine, when she did case series that she published, that destroyed the bifidobacteria species and the actinobacteria phylum as a whole. So that's
So it's
published.
basically the treatment for COVID also undermined the gut at the same time?
It was, yeah. In some people, not everybody, but yeah, for sure. And again, not understanding what each person's like genetic blueprint is or what their gut microbiome blueprint is, you don't know, right?
where
You're
it
just
starts.
shooting in the dark, yeah. So that was something we found. But then the research group that I work with, that I collaborate with globally in Italy, Dr. Carlo Brogna, Dr. Simone Cristoni, they published extensively on this. And what they found was that the virus itself, the virus is a bacteriophage, meaning that the virus takes up residence inside the bacteria in our gut microbiome. So it destroys the bacteria that we need.
So that's why we're missing this class of bacteria.
That could be one of the reasons why.
And that's where the
but
spike
in general,
protein would
and
live,
the spike,
too?
well, yeah, because it's part of it. But the spike protein has the ability to do damage without it being like attached to the virus per se. So now the current research that we're working on is looking at this and figuring out, because we think what we believe is that even the spike, whether it's from the vaccine or the virus, if it's inside the bacteria, it's causing damage, and it's causing those damage to produce these specific type of proteins called toxic-like peptides. The virus, we know, does that. When the virus is inside the bacteria, it produces these bad proteins or
So
peptides.
let's break it down just to be
Yeah,
clear,
go ahead.
because it is complicated.
It's very complicated.
have
I'm
the-
trying my best to simplify
No, you
it,
are.
but
It's
not
beautiful.
good.
You have this COVID bug that has
Correct.
these spikes coming out all
Yeah.
over it. Then those spikes can break off, or the virus itself, the COVID
Yeah, because
virus.
even in research that's published, they'll say there were parts of the viron found,
Yes.
like the N protein, the nuclear, or the. So yes, they break.
They can
yeah,
break apart,
yeah,
but
exactly.
they can also, then they insert themselves into
Correct.
this bacteria, and they basically go ahead and destroy the bacteria.
Right.
And then they create another type of agent called a toxic.
So once the virus, and this has been shown under electron microscopy, once the bacteria is teeming with the virus, they start to throw off these toxic-like peptides. They've identified over 2,000 different
Oh my God.
proteins, and each
peptides.
and each person we're finding has their own blueprint also. And in fact, we're looking at research right now. We're backing into it to see, this person's blueprint of peptides looks like this. Is this from vaccine spike, or is this from viral spike? right? Or a combination. Many people at
And
this
you can
point
distinguish that. You can see
where
what
through
COVID might have
proteomics,
Looking
yes,
at
he
protein
and
production in the body, you
using
can
mass
tell.
spectrometry and
Right.
other big time expensive equipment and machine learning and AI, they can figure that. Yeah, we're
So
figuring this out.
Not only do you get all that damage, but
Yeah.
that damage continues to multiply, and it can arise from the vaccine itself, or from the virus itself initially.
Correct. And those toxins then get past your leaky gut
Into
your
your
body and start wreaking havoc on different organ systems in your body.
It's really a nightmare, and it continues to persevere, because I remember some of the discussion you raised is that some diseases have multiplied in young people in ways that we've never seen before, post-COVID and post-vaccine. So this is something to be really cautious and to understand that there's still a lot of work being done to figure out what exactly is going on.
Yeah. And I think, everyone always, the other point I'll make too is, yes, I think that the gut is ground zero in a lot of ways. But the bottom line is the spike protein, the virus, it can access like every cell in our body, right? Like everyone always like the buzzword is that ACE2 receptor. No. There's over 24 host cell receptors that spike has a very high affinity for and binds to.
And when you say spike, you mean the COVID spike molecule.
Or the spike protein from the vaccine as well. Right. And so if it can bind to all these different host cell receptors, imagine why it's so pervasive, like throughout our body, and why it damage all the different, and why it's
so what do you do about it? Like, to cut to the chase, if it's found in the microbiome and then it leaks into the body and then it causes these toxic-like peptides to destroy other places and binds to cells all over the mind and body, because we have neurological outcomes here too that
which
are negative.
devastating at this point, becoming devastating,
what
like
do we
a tsunami.
Do? Is there anything we could do to protect ourselves from that?
Yeah. So I'm a big proponent of knowing if you have COVID. Like, I think you should know, because if you know, you need to treat it and squash the viral load very quickly so that you're not perpetuating this vicious cycle. There are studies that have come out, especially in the last year and a half, even 18 months, from major peer-reviewed journals that we respect, like Nature's Communication, that shows even an asymptomatic case or a very mild case in a young patient, okay, they have changes on their MRI. There's changes in their gray matter, okay?
In their brain.
Right. From just even an asymptomatic case.
And most COVID viruses lately, the reports we get is it wasn't so bad. I felt like I had a little cold.
So this is correct. So now, and that's why it's tricky, right? Because it's not pathogenic like it used to be, where it's going to land you in the hospital or kill you. But these newer viruses, the Omicron variants, the spike protein has mutated in such a way that it has an even higher affinity for your cardiomyocytes, your cells in your heart, a higher affinity for the cells in your brain.
To live, and it doesn't want to give it up.
My point is like, even though you might have milder disease, what it's doing to you at a cellular level and what it's doing to you both short and long term is much worse. And we need to have the diagnostics in place and the therapeutics and the prophylactics in place so that we can live a so-called normal life, but not live in the disabled, poor quality of life moving on. Moving forward. Yeah.
Can you explain just also what a phage is? Like, so the virus is a phage, but what does that mean? And what are the biochemical, as briefly as you want?
It's really, what a phage means is that the virus can live inside the bacteria. It can take up residence inside the bacteria.
Does it bind to the DNA?
Yes, it takes over the machine. It takes over the DNA. Yeah,
and then it replicates.
Just like makes it. Exactly.
That's how you get it full
That's
of
exactly
viruses.
what happens. Yeah.
Now, are there vascular, thrombotic, microclotting? Yes, let's show that. What would be a useful way to determine if a person is dealing with it? Then, of course, what's the next step to getting rid of it?
Yeah. So the way I can best simplify this, okay, is the spike protein, and this is very important, pathophysiological drivers of post-COVID conditions or post-vaccine conditions, like I like to call it, is that spike protein. The spike protein, okay, basically gets inside the endothelial cells, which are the cells that line your blood vessels. And we have blood vessels everywhere in our body. Like, people sort of like, oh, the vessels are thinking the heart all the time, but no, your kidneys, your lungs, your liver, your heart,
where you draw blood
everywhere.
From is a
okay,
vessel.
exactly. So it gets inside, and then what happens is it causes this endotheliitis, meaning inflammation of the blood vessel wall. Once you have this perpetual inflammation, you get platelets activated. You get platelet activation. When your platelets activate, your platelets then release all of these bad players, right? They release inflammatory cytokines, mast cells, like all these different things. And then it also triggers the clotting cascade. So you're clotting and you're making these sort of like bizarre beta amyloid proteins that are more resistant to how we normally break down clots.
And also, though, platelets are known for their growth factors. So because they come in, they rush in when there's been damage, and they want to heal as well as releasing these chemicals. What's different about this setting? Why are we not using platelets to both clot and fix damage?
Right. So the problem in this case, too, is that not only is there clotting, but there's leaking. There's leaky vessels and there's clotting at the same time. Okay. So that's why, to me, when you're going to anticoagulation therapy, I think it could be maybe dangerous because both things are happening. The glycocalyx, which is the layer of that blood vessel wall, that's very important, right? Like we talk about that a lot when you're having a cardiac event or something like that, that's where it's happening. It is completely destroyed and taken out by the virus and by the spike protein. And that's a very in-depth conversation. It has to do with heparinase and like this other enzyme, like it's too over everyone's head, but that's what's happening. And so you have to
be over my head
to repair the glycocalyx. You have to repair all these layers. You have to, do all these things. But the bottom line is you want to understand if the patient has this microclotting going on. Now, when I'm talking about microclotting, these tiny clots that are forming as a result of the spike protein, okay? I'm not talking about a pulmonary embolism. I'm not talking about what we call deep vein thrombosis behind your leg that can then turn into a pulmonary embolism. I'm talking about these tiny, tiny clots that you can only see under a very expensive microscope using fluorescent microscopy, okay, and lighting it up a certain way.
This is what you shared with me, and we're going to share it with the viewers.
And what's important to understand is why patients feel the way they feel, right? It's like so many just feel like they're just underwater, or like the brain fog, like living, like just like pushing through water, like living in a cloud. It's because these microclots are jamming up the microcirculation, like those like small vessels, the capillary beds that are actually sending oxygen and blood to your cells, organs, and tissues.
So if you're blocking it, you're not getting fed.
You're not right. So can you imagine what you feel like?
Well, that's why you're seeing so much long COVID, even in spite of very mild COVID infections, because this spike protein is damaging the lining of all the vessels in our body.
Correct. And some people in different places, it's like, I feel like it finds your weak spot.
Exactly.
It finds your weak spot, and there it goes. And so, so basically getting to the root cause and stopping these microclots and stopping this endotheliitis is getting rid of spike protein. We have to find very good, effective ways that work in most people to move the spike out safely, like get it out of the cells, bind it, and move it out of the body.
I think for some people, seeing it visually, and for most of you on audio, we're going to be showing this now. You can always go to YouTube and pick up the visual if you'd like. But do you want to share the pictures? Because they're so dramatic.
Yeah. Do you want to?
Hey, want to show us?
So this is one of the worst I've ever seen. I just got this back the other day. So this almost looks like a flying dragon or something, like in the person's blood. Like this is a big misfolded protein, or microclot, we call it, that's just floating in the blood. Can you imagine if you had all this just
Instead
floating?
Of this green, bright neon, it should be black.
It should be black. It should just look like this.
Right.
It should just be that. You shouldn't see anything green or blobby.
Right. So what's on this page?
These are more. It's like there's big, findings. Like a big blob here, all over. So this patient.
So it looks fluorescent.
It's hyperfluorescing.
And it's green. It's neon green. It's actually pretty,
because
but it's damaging to every vessel in the body, the endothelium or the lining of the vessels.
Right. And this green. The reason why it lights up green is because it's beta amyloid. They're beta amyloid, and that's the color it takes on.
With dementia, because we know that we don't like beta amyloid in the bottom.
It does connect a lot with dementia.
Is that a whole other topic?
Yeah. So these beta amyloid plaques, and so this patient is a grade 4 out of 4.
So the highest possible damage.
Right. In healthy people or people presumably that don't have
underlying comorbidities,
right,
or
or
other
like
diseases.
right, like because this was protocolized before the pandemic by a professor in South Africa.
So it was discovered and set in place, but then it became evident during the epidemic.
Correct. This was like she was seeing this in very, very ill patients, like end-stage diabetics, patients with refractory heart failure, and she was able to grade it and figure out, okay, this is what happens in a normal population, a healthy population. This is what happens in very, very sick, ill patients. So
presumably normal would be 0 out of 4.
No, we can make 1 to 2.
1 to 2,
we
and
can.
4 is the...
So 2.5, 3, 3.5, 4 out of 4, that's when you're getting into pathologic range.
And that's what this one looks like.
And this is 4 out of 4. Right. So anything really 2.5, over 2.5 out of...
shows that there's ongoing damage.
Yeah, that you should not have. That you should not have.
So it's a great and useful biomarker for determining interventions. Is that?
I do. We use it a lot, and we like to get the patients back to a 1 or 2 out of 4. That makes me feel better.
Can you tick off the various ways you might do that besides, for example, plasmapheresis, which is exchanging and cleaning out your plasma, which is like almost like a roto-rooter of your plasma, not your red cells, but your plasma.
Well, we could start top down. So plasmapheresis would be your, and then in different parts of the world, like in Germany, a colleague of mine, Beata Jaeger, she's been doing what's called HELP apheresis. That's very, it's even more in depth than plasmapheresis. These are very tough procedures. You're like dealing with blood products and, giving patients back those products and so on and so forth. I recently started EBU, which is extracorporeal blood ozonated therapy with filtration. There's different devices on the market.
And the filtration will pick up the proteins that shouldn't be there. And the
so ready for
molecules.
This? It's never, so EBU's been studied for like a lot of different things. Like we know it can filter out like, different mycotoxins and heavy metals and certain lipid particles and things like that. But nobody knew if it filters spike out. So we just proved this, and we sent off several filters to the lab in Italy, and it 100% filters out the spike protein.
Fantastic news.
So we know that. And the other cool thing that we discovered, and this is going to be published, that it also, the toxic-like peptides, the filter captures those as well, which is nice to add. But again, it's all about getting to the root cause.
Do you think every person exposed to COVID or the vaccine should undergo EBU or some other intervention to clean it out? And my second part to the question is, how do we repopulate the gut with the good bacteria that we need?
Yeah, we know, right. To answer your first question is, yes, that would be lovely, Florence. Can you help me democratize it?
I'd love to, because I see the outcomes
so everybody
of
can
these
afford it.
We'll talk about that.
So anyway, so
and the bacteria. Is there any magical way?
Yes. So the magical way, and we can use natural compounds, and we have put together a whole protocol to, in a more cheap man's version, get rid of mobilize the spike protein out of the cells, bind it, and move it out.
That, though? Do you mean so that it's not as costly? There are ways to actually
we
do
use
it.
Natural compounds, natural versions, natural compounds like, highly bioavailable polyphenolic compounds, like some peptides, different things that will really help mobilize spike, bind it, and then you pee it out, poop it out, right? As far as the bacteriophages go and so on and so forth. So anytime somebody now comes to me with acute COVID, and as a gut microbiome specialist, I'm not happy I have to do this, but this is the only studies that we have shown that amoxicillin, and if you're pen allergic, it would be Zithromax plus or minus Xifaxan, which is another antibiotic, that kills the phages. It kills the bacteriophages.
Did you put everybody on with COVID?
So everyone with acute COVID, I do it for a week, but I have a whole protocol in place, which I'm more than happy to share. The protocol is also using other things at the same time that will help with like really sort of, maybe I think of it like protecting the gut microbiome a little bit and then helping restore and rebalance the gut microbiome and build it back up.
So this is after a course of 1 week of amoxicillin or azithromycin with...
but they're taking other things simultaneously with the antibiotic to make the antibiotic like sort of more seamless, right? And not like really affect them as much, like
So you
binders.
protect them from the risk benefit of
I
the
try to,
antibiotic.
yeah. And
How
then I'm
about
rebuilding the gut.
Umivir or any supplements and any antivirals that would work in the
So
case?
I use ivermectin also in all my patients. Yeah, I dose them up. I give prophylactic doses. I use 0.2 mgs per kg, but for treatment, I'll use anywhere from 0.4 to 0.66 milligrams per kilogram daily with food because it's much more bioavailable that way. You know, there are
How long
other
do they stay on the Invectin?
I just keep them on the ivermectin until they feel better. You know, usually
So it
like
could
5
be
to 7 days.
a week
yeah.
to 2 weeks.
Yeah, like
Okay.
not long. It's so harmless. It's so well tolerated. I know it got such a bad rap, but
know,
it's
it did.
such a great drug. We use it for so many things. Cancer, inflammatory bowel disease, like it's
Are there any side effects with it? Not really.
I mean, contraindication or relative contraindication is if you're on anticoagulants, I stay away. Other than that, no. Some people that have underlying parasites might notice that they start to spill parasites, which is not a bad thing necessarily.
Can you clean out the parasites that way?
I mean, it's one version of treating parasites,
Yeah.
you know, layered with other antiparasitic drugs for sure.
Well, Robin, this has been incredibly fascinating. I know we dug very deep and it's very scientific, so we might have to revisit it. So I'll look forward to having you back
I would
on.
love to.
Either
Come
in
visit
person or
Lauren.
I'd like to ask you a couple questions.
Yeah.
Quick answers are fine.
Sure.
So if someone comes up to you or on a plane, which happens all the time, and says they have long COVID, they heard about you, you're famous, they recognize you, what are the first 3 things you would tell them and to do or check out?
So I would tell them to get their blood drawn. I would, you know, like I can't really give medical advice, but I'd say, go to this site and listed are the types of labs that you should maybe have done.
Great. Do you have
Right.
that list on your own social media site? or website?
It's housed in some different places. Yeah, like, you know, when I was doing work with Chris Cuomo on his Substack, and then I have it, I think, on like maybe one of the.
Great, but we can give.
Yeah, we can figure. I can give it to you.
Great.
So anyway, I
We
would
can
tell them
post
to
it.
do that.
Check out their own body.
They should check out their own body. They should really think about like a timeline. I feel like none of these doctors take a timeline. Like you can relate their symptom onset. There's a temporal relationship in the vast majority of these patients between when they had COVID or got the vaccine and when these bizarre symptoms started. It just didn't start out of the blue.
So how long usually, is there a pause in between? Like you get acutely sick, maybe it's not even so bad, you have a cold.
Some people never ever get better. And then some people, within like a few weeks or a few months, all of a sudden they're presenting with.
And then unless something gets done to stop it, they continue to be ill.
Most people, some people, there is a small percentage of patients that eventually just get better. It's
But there's
really
also evidence that there's a lot more chronic disease and diseases of the heart and the brain
More
that
than
emanate
ever.
More than ever compared to years prior to COVID.
Do you know that the excess mortality rate since 2021 in the 18 to 50-year-old group is 25%, and it's still holding at that?
Line, so 25% uptick. That's amazing. That's a quarter of all the people in that age
Excess
group.
mortality.
So dying without
Suddenly, when you hear people dying suddenly, dying
and
that,
at young age. Wow,
that's our
scary. I
working.
remember
That's
that
our
factor.
working ages, our working class population.
What's
like,
the
who
age range
works.
again for our listeners?
18 to 50.
Scary. These are people who should be in the prime of health from at least 18 to 35, and instead they're experiencing sudden death.
Parkinson's disease has increased by 50% since 2022.
Those are the facts I remember that you shared at your expert lecture. Thank you.
You're welcome.
And then we have a final query we like to add of all our guests, and then
Yeah.
I'll ask you to share your social media site because I know we had fun doing that together too.
We did. I love doing social with you. Yeah.
So if somebody just comes up to you anywhere on the street or anywhere and says, if there's one thing you tell me to do to keep my health optimal for life and extend my health span to match my lifespan, what would it be? Besides, don't get COVID and don't get the vaccine, at least in today's world.
I only can give you one.
One. Well, if you want, you can give us one that's the most important and then throw in a couple extra.
Okay. So
Whatever you want.
Okay, so my first one is surround yourself with people you love, community, like sense of community. That's so important. Like to
Couldn't
be
agree
loved,
more.
to give love, like
Loneliness kills that.
That's
There's
right.
data that shows
That's
that
right.
if you're lonely, you're going to die
That's right.
earlier in life than if you have friends and a social.
yeah.
Family, friends, whoever you
100%.
adopt in your life.
Yeah,
Good.
so that's
well, I'm
my-
glad we're friends now, Robin.
That's my first one. Can I give
Yes.
just like one?
Yes, a couple
okay.
more.
My second one, which I think is really important, is showing gratitude. I feel like if you just pause, I try to do this every day and make it a practice of mine. For a while, I wasn't. I was going through a lot of personal stuff myself and I wasn't doing it. But if you just pause and just give gratitude for like what you have, where you are in your life, the things you're accomplishing, just even 20 seconds. And there's studies that show what it does
It's another
for
thing.
your health,
Exactly.
you know? And then my third thing is, although I love all the pillars of health, normally I'll say sleep, but God, lately I'm just like, move. You got to move. I feel like people that move and like work out.
There's data
that's
for
just
that
like,
as well.
you know.
For all of those areas.
Yeah.
I have to say that I made a change in the last couple of years too, where every morning, regardless of how bad the last day was or what's on my plate, I will wake up feeling grateful. And in my sleep apps, I'll say my mood is great. And actually it does a number on your head because you feel better and
Right.
you do better.
And your
than
heart rate
saying, "Oh my
variability
God,"
goes
another-
up, right?
Exactly. I mean, I have to confess that Thank God It's Friday has become a recent, I can't believe it's Friday on Tuesday. But the gratitude, I think, is big, and probably not enough people really understand that. So thank you, Robin. That was fantastic.
You're welcome.